Assalamu alaikum. I am Sayyid Muhammad Safiul Alam Naqvi. My roll number is 1770 EP 1770152. And the topic of my presentation was viral infections, and the subtopic on which I have to present is influenza virus. So beginning with this influenza virus, we'll know that influenza virus is a highly contagious viral infection of the nose, throat and lungs that occurs most often in the late fall. Sorry ma'am, it's been days that I'm suffering from hiccups. I don't know the reason. That's why. Most often in late fall, winter and early springs. Influenza is a serious infection that affects between 5 to 20% of the US population annually. During 2017 and 2018 season, an estimated 9 lakh individuals were hospitalized due to this virus and 80,000 deaths occurred. It was just an introduction about influenza virus. Incubation period is about 2 days but ranges from 1 to 4 days. Over here I have also given the structure of this influenza virus, so one could see it, though it's related to microbiology. There are 4 types of seasonal influenza viruses. All 4 types of type A, B, C and D. Influenza A, B viruses circulate and cause seasonal epidemics of this disease. Influenza A viruses are further divided into subtypes depending upon the combination of hemagglutinin and neuraminidase. NA. Currently circulating in human are the subtype A, H1N1 and A, H3N2 influenza virus. On influenza virus type A are known to have caused pandemics. So it's clear that B, C and D are not that much virulent as that of A. And the type D influenza virus doesn't affect humans, it primarily affects cattle. Now here, epidemiology. In epidemiology, we'll be discussing that what are the risk factors of this influenza virus and what group of people are at more risk for this virus. So it's pregnant women, children under 59 months and the elderly people. All those scenarios, as we all know that microbiological infections or microorganisms may attack body and they are known as the foreign particles. So only when your immune system is weak, then they could cause an infection. Otherwise that they would be eliminated from the body through the antigen antibody action done by the immune system. So the age group, children under 59 months, pregnancy and the elderly people all have relatively weaker immune system as compared to that of adolescents, adults and the normal people. The rest are there is a list of which people may have more chance of getting this influenza virus. So it's chronic medical conditions like the cardiac, pulmonary, renal, metabolic, neurodevelopment, liver or hematologic diseases, immunosuppressive conditions such as AIDS, receiving chemotherapy or steroid, or malignancy. Healthcare workers are also at higher risk acquiring influenza virus. Moving towards transmission, so it's very easily understandable because nowadays we all are suffering from COVID, and the precautions which everybody is taking from the COVID, though it's BSL-4 virus, it comes into the category of Biosafety Lab 4, and influenza is not in that category, but the primary steps which we use as a precaution for COVID are always to be practiced because rather than COVID there are certain other viral infections and bacterial infections too. Signs and symptoms. Signs and symptoms are seasonal influenza is characterized by a sudden onset of fever, cough, usually dry cough, headache, muscle joint pain, severe malaise, sore throat, and runny nose. The reason of including all these points in this presentation was that we were assigned with this presentation, and the aim was to make this presentation not in the sense of a student, but in the sense of that you are a clinical pharmacist, and what are the essentials that a clinical pharmacist should know about this influenza virus. So in keeping that in mind, I have collected all this information and have poured it over here. Now there are certain methods of diagnosing the influenza virus. Its clinical differentiation is very difficult, and we can check it through direct antigen detection, virus isolation, and detection of influenza specific RNA by transfer, reverse transcriptase polymerase chain reaction, RT-PCR. Now, treatment. It is a viral infection could be treated with antivirals. Severe or progressive clinical illness associated with suspected or confirmed influenza virus. Clinical syndromes of influenza are pneumonia, sepsis, exacerbation of chronic underlying diseases. So we use oseltamivir, named as brand name is Tamiflu, and it's one of the most used drug all over the world for this influenza virus. The rest are PK-MERS. It consists of amantadine and rimantadine. Now, prevention. So I've told that non-pharmacological prevention have been discussed earlier, and now we are discussing the pharmacological methods of preventing this influenza virus. So it would be the same for all the virus and bacterial infection. That is the most famous method, known as vaccination. And these are the WHO recommendations for which group of people should have this. Now, case study. In order to openly display the role of clinical pharmacist and his duties in this viral infection, what I have planned and added this detailed case study, and it states that Mississippi, a 74-year-old woman, so she is elderly, present at AE at 11 p.m. and with a 3-day history of productive cough, fever, shortness of breath, and pleurisy. Portable chest X-ray taken in A shows consolidation in the right lower lobe of lungs, and she is admitted to the hospital. Here are some details about the woman or the patient, medical history, the drugs which she is taking, vital signs which are recorded. Now there are investigations which we are planning. It would be definitely ECG, she is cardiac compromise, liver function test, C-reactive protein, urine electrolyte and full blood count, sputum cultures, blood cultures, D-dimer, urine for bacterial serology, and troponin 1. Patient is diagnosed with community-acquired pneumonia and treatment plan is as follows. Now we'll do nebulization, ceftriaxone IV 1 gram, OD, erythromycin IV 500 mg, QDS paracetamol per oral 1 gram, and enoxaparin subcutaneous 40 mg OD. So these are the plan. Now, how to execute this plan? So there are several questions set. There is very less time now. How is diagnosis of pneumonia made and how is severity of illness assessed? The first one. The second one is what is the significance of these laboratory findings. So after reading all these questions and the detailed answers which I have added intentionally, because I knew that there won't be much time left to define this case study. So ma'am, I have explained it over here. You may fetch a few minutes and please if you could read it, so because I'm not able to speak more because of these hiccups, please pray for me too. So what are the possible interpretation of these microbiological results? What are the important pathogen and appropriate treatment options for severe community acquired pneumonia? And now a pharmaceutical care plan, how to carry out this all. What are the goals of therapy and how should the therapy be monitored? What are the prognosis and potential complications of community acquired pneumonia? Last one, what are the relevant social pharmacy issues in this case? And now, thank you, Jazakumullah khaira. Please remember me in your good prayers, ma'am.